nje nitwa Sam Katwere naho naraje kwivuza hano mu gihugu cy'Ubuhinde nyuma y'imyaka 2 ishize none nagarutse muri check up kugira ngo barebe.
Sam was a guy who had come about 2 years ago. He came from Rwanda and he had had an accident and he had injured his hip, and then the hip, the head of the femur, had gone into what we call avascular necrosis. That means it had lost its blood supply and the hip was completely damaged. So though he was young, the only answer for him was really a total hip replacement, and therefore I went ahead and we did a total hip replacement here, and he recovered very well, and within 2-3 weeks he was all ready to go back, and I think in about 3 weeks time he went back to Rwanda. And then he suddenly he called me the other day. He's actually a motor spare parts guy. He has a very large motor spare parts business in Rwanda. So he had gone to China to buy some spare parts, and suddenly he called me from China and said, look, I'm on my way back, can I come and meet you? And I said, yeah, why not? And so he called me one morning from the airport and said, I've arrived. And I said, okay, come over to Nova in the morning and we'll look you up and see how you are doing. And I was absolutely shocked to see the way he was doing. He's also extremely happy, and I was really happy because he's walking normally, he's running, he's jogging. He told me he's playing football, and then to demonstrate how good he was, he jogged in front of me, and then he actually squatted, and that really, in fact, I got a bit frightened because actually total hip patients are not supposed to squat, but he not only squatted, but he squatted and then hopped, did like a bunny hop in front of me, and I was absolutely amazed and really, in fact I even warned him that, hey, listen, this is a bit much, please don't do this. But he's able to squat and he's able to jump around, and he says he plays football, which is really good. Which really means that the hip has done extremely well. Then of course I went ahead and did some post-operative x-rays, and his hip is looking absolutely beautiful. I did what's called a cementless hip, that is a hip without cement. So it's integrated beautifully and it's looking absolutely textbook like. So he's doing well. He's going back, I think, tomorrow or day after, and he's very happy with everything.
Kagaragara ko bose bishimye ku buryo abadai banzi icyo gihe mbere uko ncumba jyanye uko bambona birabatangaza bate uriya se ni Sam twari tuzi byagenze gute, bahita mbasobanura ko bavura ngabarangira address zo mu dogiteri ku buryo benshi basigaye bazi nangaha bakaza bakivuza.